A lot of people leave the doctor feeling rushed or frustrated. I'm Dr Amayo, a GP in the UK, and I'm going to show you how to get the most out of your appointment. Now, a good consultation is your doctor's responsibility, but things can get missed, and being prepared can really help you get the best outcome. Which brings us to step 1. Be clear about the problem. Avoid being vague if you can. Clear details are what help us get to the root of the issue. Details like, what exactly is the symptom? Pain, nausea, tiredness? Where in your body are you feeling it? And I mean, be specific. When did it start? How often does it occur? How long does it last for? Time it if you can. Is it worse at certain times of the day? Does anything else make it worse? Does anything trigger it? What makes it better? How is it impacting you? These details help narrow down the problem. Being a doctor is largely about pattern recognition. The more detailed, the clearer the pattern. Like tummy pain. Is it high up, lower down, off to one side? Is it worse after eating or with movement? Is it there all the time or is it coming and going? It's often worth writing down the important details before your appointment. It can be surprisingly hard to remember everything in the moment. Now, rule number 2. Prioritizing what you want from the appointment. The reality is, most problems can be managed in several different ways, and it's often not possible to cover everything in that first consultation. So being clear about your priority early on can be vital in making sure you get what you want out of it. For some people, that's reassurance. For others, it's getting a clear diagnosis. Or it might be symptom management, like pain relief. Or maybe you want to avoid medications and explore alternative options. Sometimes you have something specific in mind, and sometimes you're happy for the doctor to guide the decision. All of these are valid, but being clear about your priority helps us tailor the consultation to you. Your doctor should usually check on this, but if it doesn't come up, it helps to make it clear. Okay, now let's move on to number 3, knowing how long you actually have for your appointment. In many GP surgeries in the UK, appointments are around 10 minutes, and those 10 minutes include everything. You coming in and sitting down, explaining what's wrong, any examinations, the documentation, any referrals, phone calls, safety netting, and then you leaving. As you can imagine, the more problems you bring to one appointment, the less time there is for each one. Trying to make those 10-minute stretch is actually one of the hardest bits of juggling that we do, and it's often where that feeling of a rushed appointment comes from. With that in mind, it's often worth trying to limit one consultation to one main problem, and some surgeries do have this as a formal rule. If you don't really have a choice, try not to leave the issue you're most worried about as a, by the way, doctor, right at the end of the appointment. Lead with what matters most. And if you do have a few concerns, it's worth booking a double appointment if you can, or letting your doctor know early on so they can do their best to plan around you. Now for rule number 4. I want to preface this one by saying the responsibility here really sits with the doctor. That being said, communication issues can make it really hard to get the best care, so anything you can do to remove those barriers can really improve your outcome. So if you're hard of hearing, bring your hearing aids or consider bringing a family member. Writing things down can also help. If English isn't your first language, make sure a translator has been booked. Be mindful of cultural barriers too. Speaking from personal experience, some people are taught to play symptoms down. If that's you or someone you're supporting, do your best to be open and honest about what's really going on. There are a lot of ways to communicate, in writing, through others, or in person, and the key is finding what works best for you. This is all about finding ways to get you the best care possible. Alright, now for rule number 5, managing your expectations. I completely understand how frustrating it can feel to wait weeks for an appointment, only to be advised to try something simple like a basic painkiller or cutting back on caffeine. But the reality is, doctors usually start with the simplest options first, and that's because, while we are trying to help, we're also trying not to cause harm. As treatment plans become more complex, the risk of side effects or unintended problems increase. And importantly, simple measures actually do work a lot of the time. So if you come in with pain and haven't tried anything yet, it often makes sense to start with the simplest option, unless there's a good reason not to. If your issue is common and fairly straightforward, it may be worth speaking to your local pharmacist or checking the NHS website for over-the-counter options. As long as there are no red flags or worrying symptoms, it can be a good place to start while you're waiting your appointment. On to rule number 6. Plan for things that might disrupt your appointment. This could be traffic, parking, or the usual last-minute problems that crop up when you're in a rush. Some practices do have policies where arriving late can mean missing the appointment altogether. So if you can, build in a bit of buffer for time. For parents, no judgment here. Do your best. I know you're juggling a lot. And if you have a disability or additional needs, it really helps to flag this with reception when you book so the doctor's aware and can account for delays where possible. Also, we all know appointments don't always run on time, so it's worth bringing something to keep yourself occupied. Also, try not to book your day too tightly around the appointment. Stress before you're even called in can really affect how the consultation goes. And finally, here's a few tips for the end of the consultation. Before you leave the room, make sure you understand the plan, and especially what to do if it doesn't work. You may be given also a lot of information, so try to jot key points down. You can always revisit the details more calmly at home using trusted websites, which I'll link below. And most importantly, be confident that you can come back if you need to. Some problems take time, further tests, or a bit of trial and error before we get things right. Medicine isn't always an exact science, and follow-up is often part of good care. So I do hope that helped. I'll be sharing more practical videos every week to help you get the most out of your healthcare. If that's something that you'd like, consider subscribing. This has been Medicine Made Clear with Dr. Amayo.